I'm Emily Munro. I'm based at the University of Bedfordshire, and I've been undertaking research on leaving care for a number of years, but the latest study I'm involved in is looking at how to embed innovations and interventions to support young people leaving care and ensure that they're implemented effectively. So it's understanding kind of from a business context what helps innovations to embed effectively to support improved outcomes. So that's my current study. But my other interest and why I'm here is because I've been involved in a survey on the impact of COVID on care leavers, hence this group. But Mariana is going to take the chairing role and facilitate the discussion. But we're a small group, so it should be nice in terms of opportunities for discussion. And reflecting on the potential issues and how that looks in different contexts.
Okay, thank you, Emily. Yes, I have thought of doing a very short introduction on what we've done so far in America regarding COVID. And it hasn't been researched, but in the context of course developed for residential care workers, we took advantage of that course that was dictated in 10 countries in the region. We took advantage of that to ask some questions to the workers and see what are their main priorities and their main urgencies as regards this context in the not only the living care field, but the care system itself. So I've taken one...
Frozen.
Excuse me? Can you hear me now? Am I there?
Just carry on. You are clear. We are able to receive you from this end.
Is this okay now?
Yeah.
Okay. So I said I was willing to share with you some of the results that we found in this courses where there were around 500 workers from 10 different countries. But I've taken a sample of a question that shows the tendency in the answers, because as I said, this has not been a research that I'm sharing now with you. Can you see it well? Okay, these are open questions, but what's most important is that from the question, what are your most urgent needs as regards residential care against in the COVID context? There were two answers that were repeated in all courses, and there were the difficulties in the access of technology, connectivity, internet, and computers, cell phones. And that does, on one hand, to the right of information and access to technology, and on the second hand, the one related to the staff and the shortage of staff. Carers that who were on one hand dedicated to everyday work with the children and young people, but also technical staff and health staff. So what's happened mostly in our countries, in our region, is that residential units have sort of locked down, kept the workers with the kids and the young people for so many days that this has resulted in what we call, many cases, this stressed and very overwhelming situation, and having the feeling of not having who to count on, meaning that the personnel is very few. That's on one hand. Then on the other hand, we have pursued a series of meetings with caregivers only in Argentina. That was starting in March, and was a series of meetings with 40 caregivers, trying to get to know what their situation was. And there were three main concerns or urgent needs that the young people identified. The first one was related to the shortage of mental health resources available in clinical, trying to say, translated by the time I'm speaking to you, so sorry for that if there's some mistakes on that, but that was the first one. And then the second one was related to the continuity in education. And related to this, what we call the access to technology and gadgets and computers and stuff for many of them who just left care. And the third one was the one related to the connections with peers and the connections with the friends and reference persons that wouldn't be allowed because of what we have, as I said at the very beginning, a lockdown for 150 days. So that would lead to a very, very deep feeling of loneliness, which, and this is something that I would like to introduce as a question to you, where we consider the COVID as a factor that shows us inequality that previously existed in these groups and in this system or not. In which sense do you think about this? If this is a good start to the discussion.
Yeah, it's a really interesting question, isn't it? The degree to which there's potential to illuminate issues which were already in existence, but arguably become more acute. And actually whether that context presents opportunities for doing things differently and opportunities for really highlighting the specific needs and circumstances of this group. Which is a really interesting question, and I suspect there's massive variations in terms of the potential of what is the difficult situation for everyone to act as a catalyst to improve services and support, or whether actually it increases disadvantage of this group. So there's some really interesting issues and questions around that, I think.
We have in fact dedicated most of our training courses to help workers think on creative solutions to the lack of public policies. What I'm trying to say with this is that on one hand, I do believe that the problem is a previous situation of the system itself, where there are rights that are not guaranteed, such as I said. And then now the workers feel very much into the responsibility of giving, for example, continuity to education. But they, on one hand, they don't know how to do it because they may not have the skills for that. And then on the other hand, the financial resources that are needed to get equipment, technology, cell phones, or even internet is has to be done in a very creative and urgent way where at this point, and this might be different as regards COVID from the previous situation, you have no time. You don't have much time to wait. So what this is putting another dilemma on what capacity to respond the systems have, but also how this interchange in between the social welfare system and other systems such as education, health, and or even financial system can assist to each other. And this is a problem, at least in Latin America for sure, that didn't happen before. And now, okay, so any questions so far? Anything you'd like to share?
Just I wanted to share the fact that it's really that COVID crisis highlights all the difficulties and all the structural problems we have, and the economic model then in several countries. Latin America, I think, had a huge problem with our socio-economical model, the neoliberal model right now. And the problem that I see just in Latin America is that government don't want to take the responsibility also of the people, of caregivers. There are no necessarily making the changes they have to make. There are structural changes we have to make. It's urgent. And right now we have to respond, but we don't have the support we need to respond. So it's just, yes, it's a problem that exists, but now we are really in a situation that with urgent to change the conditions of caregivers right now. And here in Montreal, we see also the precarization of life of caregivers. We have, yes, a government that stands to the people, but we see also some traces of the neoliberal system that it's counting on individuals and not in a social system that can really support the transition. So we are also confronting in a different way. We are confronting the same problems right here.
I was interested in whether in Montreal there've been kind of bottom-up initiatives and initiatives from the kind of grassroots and practitioner level, because I was struck by what Mariana was saying about thinking about creative solutions and the degree to which that's sometimes generated from those who are working on the ground, and whether there's been evidence of practitioners and social workers mobilizing, and in spite of perhaps the absence of states taking responsibility for this specific group.
For caregivers, we can see that it's like really a fracture, because for all the protection system, we have a protection system that it's really strong. We have a lot of support, social support, but for caregivers, it's just we forget them. So yes, we have a group of researchers that are really active. We have social civic groups that also are starting to activate. We have caregivers that have organized to activate also and to start to making demands to the government. We have, in fact, a group of caregivers that make a network with other caregivers in other countries to start also to first taking into account all the necessities of the caregivers in different countries and start to making like the play order, really start to I forgot the word. To search some really search to the government to mobilize, but also this civil community. So, but we don't have a social support from the government right now.
Mm-hmm. What does it look like in your context?
Can I please say something?
Yeah, absolutely. That's what I was keen to hear.
Thank you so much. Well, I think these findings are very interesting, and well, I just have, I think, a couple of questions on the presentation. Now, when it comes to caregivers, we do know, especially for those who are in residential care, I don't know if it's just the situation or here, or whether it cuts across, I mean, everywhere. We do know that at one point they are bound to leave care, where they're going to now reintegrate with their families or communities. And so what I want to understand is whether in this particular case, are you looking at this particular phenomenon because of COVID-19? Okay, in fact, what I'm trying to ask is whether these children, did you say they were children? By the way, did we just talk about caregivers or children living care?
Or youth living care, maybe?
Oh, youth living care, thank you so much, okay. And so what I want to understand, okay, not just for you, but I think again, I'm speaking to the presentation, I want to find out whether they are living care because of the pandemic, which is now, well, yes, which is affecting the whole world. So that we can at least maintain social distancing, because we know that another way to beat COVID-19 is through social distancing. And so given the numerous, the numbers of these children who are within these residential care, we can quickly get the virus. So that's basically my question. Talking about the concern of the caregivers in our study, we are saying number one concern was shortage of mental health resources available. And so I would ask if maybe you can speak a little bit more on that particular issue, so that at least I understand what we mean when we talk about shortage of mental health resources available. Yeah.
Okay, my understanding of I think there were two questions, right? Emily, if you can help me out with that. The second one was about mental health. Is
right.
that?
That's true, yes.
And the first one was, again?
I think my summary of it would be, and correct me if I'm wrong, it was about the risks posed in residential care in the context of COVID, and risk of infection, and whether that was precipitating young people leaving and moving out of residential.
Right. Yes, yes.
And it'd be helpful for me just to understand the context of residential care, because it looks so different in different contexts. So what size are the residential homes in your context? So our residential units would be 4 to 6 young people, but I imagine elsewhere they're much larger.
In our context.
Yeah. So what sort of size is a residential care home for young people or children?
Yeah. Yeah. Well, I think I can talk about the age range. Those who are in residential facilities are usually between the ages of 0 to 18. Right. So yeah.
Huge age range.
Yeah, or 21. Yes.
And then how many children would be in a children's home?
Well, that they would differ according to the facilities. Yeah, but in most cases they are many.
So they're large.
Quite a number of them, and so yes, given the prevailing situation of corona, it of course exposes them. They are likely to get infected in numbers.
Thanks. That was really useful in terms of context, because actually the risks and how you might manage that will look very different.
Yeah. That's why I wanted to understand whether, given your context, you also are experiencing situations of care living in large numbers, basically on the basis of COVID-19. Does it have any impact?
No, so speaking from an English context, the emphasis has tended to be to try and reduce the requirement for young people to leave. So remaining in care is seen as protective, not a risk. So the idea is to maintain the care and support in a familiar environment, whether that's foster care or in a children's home, so that young people aren't having to survive and negotiate the transition in the context of COVID. So certainly in our context, the emphasis has been on encouraging and supporting and enabling young people to stay in care rather than a tendency to leave.
Okay.
The context, it may be very different for others. So Mariana.
Yes, again, as I said, I wouldn't be able to say it in a very homogeneous way, because a residential care system in Peru, for example, is very different from the one in Argentina, even when in the whole region we have almost all residential care versus very little foster care. So that's a first big issue that we have. And then secondly, there's still what we call micro institutions in some countries, such as Mexico or Peru or Bolivia, where there are an average of 50, 60, 70 children or youths, and that makes it very crazy, but still like that, unfortunately. Here in Argentina, which is the context that I know the most, I would say that at the very beginning, the reaction of the system was the same as Emily described, in terms of keeping the adolescents and the young people. But then, as a consequence of the lack of resources, for example, the residential care units might be too small to isolate sufficiently when there's a case of COVID. The policy is to evaluate whether there's a reference person that would be consistent enough to support that transition process in a home where my daughter is just getting in. That's why I'm just okay. Sorry for that. That's what we got for the city of Buenos Aires and the province of Buenos Aires, where we have 40% of all the children and youth and adolescents in care. So it can be considered attendance. In the north part of the country, where the poorest area, the provinces, the situation is a bit worse. in terms of they don't have resources in residential care units, and there are no reference person to. So in those cases, the national government has decided to send the like a money transference card straight ahead to residential units, which is something that they've never done before because we're a federal country. So they don't usually get direct assistance to. So we see this as a good decision. It's a very urgent, let's say, solution, or a very short-term solution, but it gives you also the possibility to start a contact and a conversation straight ahead with the residential unit and get to know what the situation is like. Because one problem that we have, and I'm thinking that it might be the same or similar in your region, is that the provinces wouldn't tell, really, they don't give data on what it's really going on. The information they provide is not, you cannot trust it completely.
Okay.
So a good way to know what's going on is whether the executive starts a conversation or starts an assistance with, but look, it's still in a very, very, let's say, informal context. Like, this is the only public policy that's directed straight ahead to alternative care system, if so.
Mariana, you spoke also of a lockdown, that all the residential workers were locked down with the children. How that it works?
That is very crazy, probably the craziest thing. It doesn't happen in Argentina, but we've heard a lot, and it's so good to be in the field, you know, with the workers, because you can hear everything at first hand. So Bolivia, we've heard many cases of workers who spend, mostly women, spending maybe months, 2 months in the residential care unit and not being able to see their kids. Also Peru, also Guatemala, also Ecuador. So yes, the countries where the system doesn't have a possibility to react in a different way. So on one hand, you have the fear to what's going to happen, and then this idea of protecting children, but not protecting workers. So that's it, because the workers are in care, taking care of them, and they are really stressing and cannot have probably their minds, it's not their minds, but they don't feel they're doing their work well enough, full of worries. But also there's no public transportation available to.
So you can go to your home.
So this is all what we said at the very beginning. The very poor economic contexts apply to this type of solutions. And we received a message from a worker lady in Bolivia that really was very touching to us, who said, I want to be in the course, but I have to tell you, we have only one phone in the whole residential unit. I am here, I've been here for more than 3 weeks, and have no internet. We have only access to what you call data, or that's internet, 4G or what. And that was all. And this is all. This is not an exception. The management and the access to technology is such an issue. Such an issue. I would say that the most challenging at the moment. Yeah.
And if we think of schools that are homeschooling in several countries, that they're making online classes, they can't access for schooling finally.
No, I don't know how you see the education system is handling this in your countries, actually. If it is.
It's been very variable. I've been surprised, certainly our students, a number of them are still struggling with access to the learning because it presupposes that you've got the data and you've got a laptop. And I think there was sort of an assumption that most students do have those things, but certainly at our university, that's not the case, and it is a real live issue. And as I say, I think people were quite surprised by that because it does vary across the university sector. But we're very much a widening participation university and have a number of students who traditionally wouldn't have been able to go to university, who live locally. So yes, massive issues for us around that.
There are also here in Montreal, we have seen the same problems in the university, but also for schools. And we can see the inequalities finally. And all the people that thought that all the kids and all the youth had the same access, but it's not the case. So that reflects another time social inequalities.
When we were discussing among the professionals in the course, what position to take as regards all the shortage of everything, and what to say to continue there, you know, and have a spirits of like the key messages. And then one thing that I think is really helping out is, again, the peer-to-peer support. And this is being so important. We've been learning a lot from it in the last 10 years, probably. But now within the residential, in a pandemic, then the roles that peers can take in helping out others for educational support, in taking roles in certain type of activities in the residential itself that would have never happened in other contexts, such as cook or such as give information. Like one residential unit talked about having key informants. The young people would be key informants to anyone getting in the residential unit, and see if the protocol was being respected. They identify symptoms in advance, and that they would all be necessarily well informed about this, and how the peers are the ones who spend the whole day together and mostly can see what's happening to a mate, a friend, or in that was one of the big supporters. And the other one was, again, going back to what play means. Going back to play, okay? Because play is supportive, protective. You don't need much resources. And again, this second, say, level of peer-to-peer means the workers and the young people and the children are peers in this situation. We're all peers, which is something, again, very unusual but it's an opportunity. So I encourage workers a lot to play. They may feel very overwhelmed on responsibilities and having to respond with skills they do not have. Technology, for example, how to pursue classes. And then we said, okay, education is very important, but then this is such an extreme context. Let's go back to build a calm atmosphere, secure, what brings us feel secure and calm to move forward, because it's very changing also, and it's hard to understand in some countries why this continued like this, or why suddenly everything is open up and then closed down again. And so it really, those were, if so, the two would help was to put themselves again in, how do I say this in English? I have to think. Ponerse en eje. A ver, Rosita, si me ayudas. Ponerse en eje, ¿no? O sea, ponerse en, trying to find the right word. Well, to go back to
realienate, go to the simpler, go to the basics. Donc,
yeah.
Back to basics.
Yes.
Back to basics. That's it. Thank you, Emily.
That's really interesting. I think there's something interesting you were saying, which is sort of about a degree of equalizing. So that power dynamic between worker, young person has actually been unsettled in a really positive way.
Yeah.
And there's something quite interesting, I think, about reflecting on the opportunities and the unintended benefits which come out of something which is awful. And also thinking creatively, because we get so fixated on needing resource to fix things. And actually those opportunities that aren't underpinned by more money and it has to look like this can be really positive and affect really important changes, which I think is sort of quite a nice kind of message, if you like.
And also for agency.
Sorry.
Sorry, it's also for agency, because all the people have the right finally to search some solutions and creative solutions, because all the system, you know, there are several obligations, all is real structured, organized, and afterwards have really this agency for making things, for taking action. That changed also I can't reach the word. It's French that comes to mind. That's that. Finally, it's also the right to make differently and making all together. So.
It's really interesting. I was conscious there was another question which was about mental health provision.
Yeah. Can you do you want to contribute to that, Emily, or I just?
I was just reflecting on it being a question. I think certainly it's something that people are mindful of. Certainly in England, some of the research has suggested that support around mental health in transition is a real weakness. So the thresholds for support are much higher once you become an adult. And often young people fall down a care gap around mental health needs, so that the model of care and the provision you get from child and adolescent mental health services is very different, and also often isn't carried forward when people make the transition to adulthood. So they're either not eligible for the same level of support, or they disengage because it doesn't fit with their needs and circumstances. So it's certainly an area that more broadly is an issue in terms of our practice. And I think that's one of the interesting things, the degree to which you focus on COVID as the issue, or actually whether it's actually that in the context of much wider issues that we're mindful of anyway. And so then how that plays out with the added complexities around COVID. And time will tell, I suspect.
We have a very specific problem as regards mental health in COVID context, which is the shortage of medication.
Okay.
So many young people have mental health treatments that include medication, psychiatric follow-up. And that has been suspended either because doctors are dedicated to emergencies and all dedicated to COVID, or either because they are not seeing patients. So that is a very at-risk situation.
No.
And also for the young people who just left care, they have this double task, so to speak. They have to learn how to reach to the hospital and take the appointment and get the medication, but at the same time they have to learn how to deal with not having that, or either finding it out in a different way, which is not easy at all because the medicine is very expensive. So it is all what even when we have a living care law in Argentina that is giving like an 80% salary to all caregivers, that is not a lot to cover, for example, medicine. So
that's really interesting. So I'm just looking at the time. I think we're going to have to head back in a moment. But it's been really interesting to get a sense of kind of different contexts and what is kind of traditional challenges for care leaving, as well as actually the added complexities, but also the opportunities around COVID.
I have a little question for Katisha, but I don't know if we have the time, but I want to know what age in your country you can go from care, because at least here is 18, but I don't know in your case at what age they become out of care.
Okay, you meant the recommended? Yeah, the recommended age at which these children or young people can leave care. Well, it is usually 18. At times you will find that it goes to 21. So between 18 and 21, that's the time when they are usually transiting from care facilities. Yeah. Okay. So now you are giving me a bit of a sense that it might be 18 for most of the countries. Can we go by that maybe?
Sorry, what was the question?
Okay. Yeah.
Most countries stay till.
Yeah, what I wanted to understand was whether would it be safe to generalize that the majority of countries are recommending care leaving age as 18?
I think a large number, 18 is the typical age of leaving. There's wide variations on the age you're technically allowed to stay till.
Yeah. Okay.
So that does vary. So there's often a difference between the two, but 18 tends to be, I think, fairly typical in terms of actual day-to-day practices.
Yeah. Okay. We still have time? Or
I'm going to have to go because I'm presenting, but it was really nice to meet everyone.
Okay.
Thanks a lot. Bye.
Thank you so much.
Thank you.
Thank you. I'll see you.